Good afternoon, everyone. I'm April Cummings from Radio Cayman and for Donna Bush at this hour. We'd like to welcome the media, viewing and listening public, and our sign language interpreter, Miss Carolyn Powell. Thank you, everyone, for joining us. We do want to say right off the bat that if you've sent in a question and it has not been answered by the panel by the time that this press conference is over, you can go online to gov.ky and click on the FAQ section for those answers. Also, if you are a civil servant, we want to give you an email address that you can use at CIGHRconnect@gov.ky. So let's begin by welcoming our panelists today, His Excellency the Governor, Mr. Martin Roper, Premier the Honorable Alden McLaughlin. We have the Commissioner of Police, Mr. Derek Byrne at the end, and of course, Health Minister the Honorable Dwayne Seymour. Thank you all for joining us today. So let's start with you, the Premier. What is the latest?
Thank you. Hello, everyone. This morning, we announced a number of measures that the government is proposing to take to deal with the increased threat of COVID-19 spread through the community. Those were the imposition of a curfew starting this evening at 7 and going through till 5 a.m. in the morning. I know this morning I said it would go through until 6. There's been a slight adjustment by an hour. The curfew will commence at 7 p.m. this evening and go through to 5 a.m. tomorrow morning. The other measure that I announced, or we announced on behalf of the government, was what's called the shelter-in-place provision, essentially saying that all non-essential businesses should close and all non-essential personnel should stay home. We have spent, since we left here at about 11:30, Cabinet has been working, trying to come to grips with what the shelter-in-place provisions would mean. We have been, quite frankly, overwhelmed, and not in a good way, by the sheer number of requests for exemption from the provisions of the shelter-in-place order. Quite frankly, it seems that the message has not gotten through to the private sector and to employers that we have on our hands a national health emergency which is capable of killing hundreds of our people. We have requests for thousands of persons being exempted since 11:30 this morning from the provisions of the shelter-in-place order. It would be pointless for us to proceed with a shelter-in-place order if we granted all of those exemptions. We have grappled over the course of the last few hours with how we deal with this. We have requests for almost complete exemptions from the financial services industry, as an example. Financial services industry is capable in most instances of operating from home. Most of them have business continuity plans. Everybody's concerned about the economic consequences of the order that we propose to make. We are too. But the economic consequences can never be more important than lives. What we are proposing we know is going to have a significant negative economic effect over the course of the 10 days that we're proposing to put the shelter-in-place provisions in place. But as I've said over and often, if we succeed in this strategy of containing the spread of COVID-19 through the community, we will not only save hundreds of lives, but we will save the country from having to go into lockdown for months with all the consequences that flow from that. And so we've had, for the purposes of today, anyhow, had to abandon the plan to put in place the shelter in place order this evening, and to turn our minds over the course of the rest of the evening and night and tomorrow to how we grapple with this. I have to say to the entire country that if we conclude that we will not get the cooperation of the business community and employers, who quite frankly seem to be prepared to risk the lives of their employees in order to ensure that their businesses continue, we will move to far more radical measures, and that is a 24/7 curfew. We are not going to allow economic considerations to kill our people. Not as long as I am Premier am I going to sit back and let those who believe that economic considerations come before anything else persuade me and my government to do something that we know would be reckless. So we are going to proceed tonight with the curfew from 7 to 5 a.m. in the morning. I am going to list the areas which will be exempt from the curfew. And then tomorrow we will continue our consideration of how we move forward with respect to the shelter in place provisions. I want everybody to believe me. The government is doing everything it can. We grapple with these major considerations. But I am coming to the view sometimes that we are going to have to bury some of our own people for the message to get through that this is a national health emergency. We need everyone's cooperation, particularly the business community. Some of the requests I've seen claiming that they are an essential service leave me absolutely shaking my head. Everything that happens here is not an essential service. I'm going to provide now some examples of what we believe are essential services and those that are going to be exempted. The employees who are required to work during the curfew will be exempted over the course of this evening. All emergency and essential services, including the police and security services, 911, fire, the prison service, Customs and Border Control, Department of Environmental Health and Island Waste Carriers, emergency medical, including the HSA, Health City, Doctors Hospital, ambulance services, and all doctors' offices, supermarkets, namely Foster's, Hurley's Supermarket, Kirk Supermarket, Kirk Market in Cayman Brac, Billy's Supermarket, Tib Mart, Cost You Less, Priced Right, Progressive Distributors, K. Isles Enterprises Limited, Cell, Cayman Distributors Group, Jake Scott Group, Blackbeards, Uncle Clem's Distributors, Heston Limited, Medak Supply Limited. And the utilities and infrastructure, namely Port Authority, Water Authority, Cayman Water Company, CUC, Salt Petroleum Cayman Limited, Rubis Cayman Islands Limited, Home Gas Limited, Off-Reg, Cayman Brac Power and Light, Clean Gas, Refuel Limited, Flow, Digicel, Logic, C3. Those are the companies, the entities whose employees who are required to work during the curfew will be exempted. Obviously, this is new, just being introduced. We may have missed some critical entities off of it. The commissioner, who will speak for himself, will exercise, his officers will exercise their discretion as they seek to enforce this curfew over this first night and early morning. So we hope everyone is going to cooperate with that. We are in many ways feeling our way here. We are in uncharted territory. Everything we're doing is trying to, as far as possible, improve the chances of this country avoiding the death and disaster that attends so many countries around the world. I beg the people of this country to please support what the government is trying to do. Thank you.
Your Excellency?
Let me just say I fully support what the Premier has just said, and I don't think we could have been clearer in recent days about the enormity of the health crisis we are facing and what we're wanting the public to do. So I thank the Commissioner, because we are ready for the curfew tonight, which will go ahead, but we do need to do further work on the shelter at home or in places tomorrow. And I just want to say that we are still encouraging the vast majority of people who do not need to go to work to stay at home. Everything we have said about those people who do not need to go to work should stay at home. And I would like to commend the Civil Service and the Deputy Governor, because the Civil Service has effectively closed down large parts of its business. We have the large numbers of civil servants working at home. We've closed libraries and museums. So civil service is doing its part, and we really need business to join us in doing that tomorrow.
Ladies and gentlemen, I fully endorse what the Premier said. These measures being taken will hurt everyone, including us up here. Please, we are begging you, let's ride this out for 10 days of curfew so we don't have to put 10 weeks of 24 hours curfew to rid ourselves of what is known to be here, the coronavirus. And it's killing people. It's a serious disease, and it is not prejudice. If you feel you need to be mobile and on the road, please email essentials@gov.ky. We are under great threat, ladies and gentlemen. We don't want to lose any lives. If I must say, the projected loss of life, if we didn't put these measures in place for our approximate 65,000 people, 60% of our population is actually supposed to get sick. If we didn't put the measures that we put in place, we are supposed to, by projection, by World Health Organization and other authorities, lose 800 people. 800 people are supposed to die if we don't put the measures in place, according to all statistics around the world. People, my friends, your family, mine, our children, our elderly, come on, Caymanians, we can do this. Just a little patience for 10 days will mean the world in determining how quickly we are ready to function again for the world's business and for our children to get back to school. Ladies and gentlemen, please take this serious. I thank you, and God bless these Cayman Islands.
Thank you, Minister. Commissioner, would you care to add anything?
Thank you, and good evening, ladies and gentlemen. I'm reiterating the obvious. The situation is serious. The Governor has provided me with a written permission to proceed with the curfew. I have now issued my order, which goes into effect this evening in just under 2 hours' time at 7 p.m. this evening. There will be full application of the curfew from 7 p.m. this evening. It will run for 10 consecutive nights right through until the 3rd of April at 5 a.m. I have said that before. I'm just reiterating the message. If you do not need to be on the road, you should not be on the road. The application of the law as it stands, and I explained the law situation yesterday, I hope I explained it clearly to everybody, and the consequences are that unless you're an essential person utility person that needs to be on the road, you should not be on the road. We will be fair in our application of the law, but it will not be liberal application. We must protect the Cayman Islands. We must work with government, and we must work to the government agenda. So I will shortly brief my team back in police headquarters who are waiting to go on the road. The visibility will be high. The enforcement, as I said, will be fair. We will use common sense and sound judgment insofar as we can, but please do not expect a liberal application. We will take names of addresses of persons who are on the road outside or during curfew hours, and the consideration to prosecution will be given in these cases where we have to make definitive decisions. As the Premier said, more decisions would have to be made tomorrow. So while there's some room for interpretation tonight, as we proceed with the curfew, that will become less and less, and it will be total application of the law of the curfew. Thank you.
If I might add something which I omitted, restaurants as well, restaurants that are providing delivery service, because many people in this country depend on restaurants for their meals. So restaurants that are providing delivery service will be able to operate, their delivery persons will be able to operate until 9 p.m. to ensure that everybody who needs their dinner delivered to them are able to get it.
So, gentlemen, before we turn things over to some of the press questions, please bear with me. Some of these you have answered, at least in principle, but there are a couple, I think, that specifically might be worth addressing just to drive the point home. One of the areas that seems to be a bit confusing for folks is staying at home and working at home are not the same thing. So some businesses are expecting and have set up their employees to work from home. But there is also the matter that they have small children, childcare, and people are really trying to grapple with how to do everything the way they're supposed to. So the question, I've probably gotten it 6 or 7 times, has had to do with people who have nannies or caregivers who actually don't live in the home but are at other locations. So that question's been posed. Is there any advice or support or any information you can give them for how they can help resolve that problem for themselves?
You mean the helpers and nannies being allowed to come to work?
Yeah, or an elderly person, yeah, an elderly caregiver.
Yes, that's fine. I mean, we're not trying to make life more difficult for people. I mean, that's what's happening, but we're not deliberately trying to do that. So measures like that, which are entirely reasonable and helpful, they're already essentially members of the household because they live there. Well, they're there during the day and they're working. So those are fine.
As long as the curfew hours are observed.
As long as the curfew hours are observed. And we've set up a website, essential@gov.ky, which is the one that's almost crashed with all of the requests that people be made designated essential workers, to be able to deal with these sorts of situations, because this is very imperfect, what we're trying to do. And we know that we'll have to constantly make adjustments along the way, and we want to be able to take on board people's concerns and issues and be able to try to accommodate them in the most reasonable way. So that's fine. What I am complaining about bitterly is about what is clear to me to be a lack of acceptance that we are in really, really dangerous times and that we have to take radical action. What the reaction that we are getting from much of the business community is, I want to be able to keep business going as usual, regardless of what's going on. So make everybody else have to comply, but declare me and on my business an essential service. So we really have to try to work through this, because, as I keep saying, if we can get to 10 days without this place having to deal with significant community spread, we would have achieved a huge, huge victory. And thereafter, life can truly return to some semblance of normalcy. and people's fear can start to recede a bit that they or their family members may be subjected to this terrible disease.
Reshma, I see you standing by. Would you like to ask the first question?
Thank you. Thank you, April. Good afternoon, everyone. Commissioner, I just want you to, if you can, I know you talked about that you're going to be looking at prosecution for anyone who breaks the curfew. Just for the listening and viewing public, can you just tell us once again what the penalties are for breaking the curfew?
Yeah, thank you, Reshma. So the penalty for breaking the curfew, and I repeat the hours, 7 p.m. To 5 a.m. from tonight, which is just under 2 hours' time, running right through till Friday morning, the 3rd of April. The penalty is a fine of 3,000 Cayman dollars and to a term of imprisonment not exceeding 1 year or both. It's pretty serious, and as I said, we'll apply it with sound judgment, common sense, and in fairness, but without being liberal.
Okay, thank you very much. Premier, now I know you said that the business owners, the interactions would have prompted us to put on hold the list. But today, the British Virgin Islands has imposed fines for business owners who break the curfew or who do not follow the curfew that has been implemented there. Is that something that may be under consideration by your government as well, to kind of clamp down and keep the curfew hours within the times that you've set?
I think the Commissioner has just answered that question. There's not a separate provision to deal with business owners. Anyone who breaks the curfew is subject to the same penalties.
So a couple of questions. Frankly, a lot of them are really very specific about how the curfew will work. One person asking, for example, I understand it's a curfew, but can I still be in my yard? I know these may seem like simple questions, but people are very concerned and nervous, and they don't want to do the wrong thing in many cases.
Yes, they can be in their yard.
That's where we want them, actually.
The
Not on the road.
Not on the road. The supermarkets, we probably haven't left the building too much today, but the supermarkets were extremely difficult for folks today, balancing the limited numbers allowed inside, the social distancing issues, and so there are lines well out into the street for people trying to get their shopping done. Any response to what's going on? Any suggestions on ways to improve it? I know we're asking a lot of you, but these are what people are dealing with.
Well, we keep saying this. People don't need to shop as much as they're doing. This is not some speculation on my part. I've spoken to all of the supermarket owners, and they are stressed to the max themselves. They've never seen anything like this. There are less people here now than they've been in years. But they are selling out in a day what often it takes them a week to sell. People are panic buying. They don't need to do so. We have been guaranteed by the supermarket owners that there is more than adequate supply, not just on island, but constantly on its way. We don't have to stock up as though this is a hurricane and the places are going to get destroyed. It is lives that are going to get destroyed if we don't stay home and take our time and not panic buy and panic generally. People just need to calm down a little bit and follow what the government is trying to do. Stay at home as much as you can. Stay away from other people who are not part of your family. Tell the elderly people in your home or in your family, keep them home, keep them away from the risk that is out there. That's what we need to be focusing on. There's going to be no shortage of food. Nobody's lights are going to get turned off. Nobody's water is going to get turned off. Nobody's house is going to get foreclosed during this period. We just need to hunker down and ride out this storm. In the middle of the hurricane, nobody goes outside. I don't see any lawyers running down to their offices. They're all hunkered down. That's what we got to do for the next couple of weeks.
Question from Wendy at CNS. Could you give some examples of businesses who are saying they're exempt? She's wondering whether these are largely offshore. And also, of course, she would like to know what the population estimate yet. Do we have that since the departures?
Quite frankly, and I'm not exaggerating, everybody from fishermen have asked for exemptions. So it's not just the financial services people, although there are loads of them, but there's just about every category of business that exists in Cayman. Hundreds of them have emails seeking exemptions. So everybody thinks they should be an essential service. They're designated as an essential service. That's not going to work.
Some people have suddenly found themselves in isolation that they didn't plan on, weren't expecting, and now are struggling with things like how are they going to get their groceries done? How do they get help to do those things, particularly if it's just them and a small family unit?
Well, we all have friends and family, and government is doing everything government can. But we have, as a community, to do what we've always done best, pull together, help those who need help. We can't simply expect government agencies to deal with all of these things because we simply do not have the capacity. And I'm not going to be one who sits here and say, oh, we'll send that to Department of Children and Family Services and they'll sort it. They won't. They can't. They're already under massive stress dealing with a whole range of other things.
Just to build on that point, Premier, supermarkets are actually offering delivery services. Will their delivery personnel be allowed to do those deliveries outside of the curfew hours?
You mean inside the curfew hours?
I mean inside,
Yes.
sorry, correct.
Yes, I listed each supermarket by name.
Perfect, thank you. Someone who missed it asked. We also had a question from quite a few from people with pets who are asking if they can get in trouble for walking their dog and taking their dog out to do its business during curfew. And I have to ask because it's been
Take the dog out where?
outside, walk their dogs outside,
Outside where?
their house, on the street.
You're not allowed on
Strata.
the street during the curfew hours.
Thank you.
Another question, can parents of high-risk children and elderly parents be forced to report to the workplace of someone who is workplace of non-essential service? I think that would be a no.
No.
Where should people email if they just have questions that they're trying to get clarity on? Whether it's, as we've talked about, they want help, they need support, is there sort of a central point that they should go to at least begin that search? Perhaps the gov.ky website?
I think I was thinking, yes, Danny, thanks.
Danielle, come.
Thank you very much for that question. We do have an neoc.gov.ky for all flu related and medical related questions. We also have a hotline for all questions relating to evacuation, and that again was the 244-3333. But anything related to flu medical questions should again go through the flu hotline. Thank you.
Thank you, Danielle. This morning, the Premier made a comment regarding the possible reduction of persons gathering from 10 to 2. Are we at that stage yet? Could you speak a little to that for those who may have missed it this morning?
Well, we aren't officially there because we weren't able to get the regulations through Cabinet today for reasons which I've already outlined. But that is the plan, that it would not be permissible to gather in groups of more than 2 unless they were members of your household once we get the regulations through. And we will get them through tomorrow, this other issue notwithstanding.
Kevin, sorry, go ahead.
Kevin Morales, Cayman Compass. Minister Seymour, we had talked earlier, or Dr. Lee had talked earlier today about, and he said several times, they're following World Health Organization guidelines and other organizations' guidelines when it comes to who is tested. In light of the announcement this morning about another positive test, is there any consideration that you're aware of expanding testing in the way it's done right now, those protocols?
No changes right now to the protocols that we're using at this time. Maybe if it becomes more widespread, then definitely.
Okay, thank you. Is there any concern from you, or have you heard any concern about the fact that, there was the gentleman at Health City, 30 staff had to be quarantined after he tested positive, and I believe there's 14 staff, if I'm not mistaken, at HSA because of the patient there. Is there any concern that any more positive cases and we're going to have to isolate more staff than we can afford to isolate?
Well, that's always a concern, but what gives us comfort is that the gentleman at Health City, for instance, was almost a month ago. And these symptoms do develop within 7 days. So that gives us some comfort.
Okay. Last question for you. You had mentioned this morning that more ventilators arrived on island. Can you just confirm, do you know the number that arrived today, or I'm assuming recently?
John, do you want to?
CMO maybe can answer that.
No problem. Dr. Lee, I was just asking the minister if he's aware of the number of ventilators that arrived on island. I'm guessing it was today or possibly yesterday.
I know that the HSA have had 4 delivered. I think there has been some others in other quarters, but I don't know the numbers for the other areas.
Okay. All right. Thank you.
Mr. Premier, I know you gave a list of essentials. A member of the public noted that pharmacies did not appear to be on the list. Is that the case?
Well, the pharmacies will not be open during the
curfew hours.
The curfew hours, no. Understand, these places are not open during the curfew hours.
Anyhow.
These are personnel that are needed to stock shelves, to carry out essential services like the police and the security and so forth, and do repairs and so forth if you're dealing with the utilities. It's not that they're open for business that you can go in and purchase things. Right?
Ms. Ledger from CNS asked again about the population estimate. Do we know where our population stands now that we've had some departures and some returns, for that matter?
I think the number is somewhere around 6 to 4,000. It was I think very close to 70,000 before all of this started.
Another question before we go to Reshma. This is from the public. Is McRuss Grocery Store on the exempted list of supermarkets? Now, I didn't hear you say it, so you may have.
No, it's not. It's not on the list that I was given. But obviously, all of the stores that need to, they're not allowed to be open. This is the point I want to make. They have to close by 7. This would only be personnel who are there to stock shelves, clean the place, do whatever they do so they can open in the morning. But this list is clearly not comprehensive. But as I said, the commissioner knows full well, and not because I give it to him, but because the law gives it to him. He has discretion to decide what to do about these circumstances. As this thing crisis wears on, we will obviously get the opportunity to refine these things a lot better. And by tomorrow afternoon, I'm sure we'll be in a much better place with who gets exempted from the curfew for the purposes that I've described.
We do need to mention a quick correction. Ms. Coleman from Hazard Management came in and says the address is neoc@gov.ky. That's neoc@gov.ky. Is that correct? So if you have questions, that is a good place to start. A rather sensitive issue, I've been asked, there's someone who has had a relative pass away recently, and they're thinking about funerals and how that works and how they should instruct the funeral homes. What should they do? How should they handle this? It is very difficult. As you know, we're used to very large funerals here, but even the minimum traditional funeral has pallbearers, so it can be quite
Right.
difficult.
So we're very sensitive to that. And the draft regulations which we've been considering would allow 10 family members plus the pallbearers plus whoever is officiating in one confined area. Subject always, of course, to the distancing requirements.
A question for, Reshma, I'm so sorry.
No, that's okay.
Just a question from someone about essential workers. Because they're in such high demand, one of the concerns is their own ability to take care of their needs, their feeding their families, that sort of thing. Are any arrangements or special provisions being made to help them, whether they're in government or outside government,
Help them how?
in order to get those things done? So, for example, if it were a hurricane, one of my former employers, I don't know, would have had the gas truck come around and fill up the cars. It's a long time ago, but that assisted so that the employee could continue working, doing, at the time, what was considered an essential job. Not asking you to answer that per se, but are those kinds of provisions being looked at or thought about at this time?
Not that I'm aware of.
You can add it to the list. Apologies. Reshma, please go ahead.
I'm not going to make up stories for you.
Thank you. Just to clarify, Premier, if you can, emergency services, for example, electricians, plumbers, AC people, would they be allowed to work inside of the curfew hours should any emergencies arise? Would that present any sort of issue
If it is a
for them?
genuine emergency, absolutely. And obviously, if the responder, if the electrician or plumber who's going to do the emergency repair was stopped by the police and explain the circumstances, the police, I'm sure, will act with discretion once they determine that what is being said is actually genuine.
Okay, thank you. I know Dr. Lee is in the room. I just wanted to get an update if he could provide us. This morning he told us that we were expecting some feedback from CAFA today. If you can provide us.
I'm afraid I don't have anything to feed back from CAFA at the moment.
Okay, well, since I already...
So we have received some information back, but we need to process it from CAFA. But we have received the results of the first 20, but we need to process that information.
Okay, since I have you on the podium, don't run away just yet. I know we would have discussed this prior, but the questions are still coming in relation to the student who was taken to hospital, people who are concerned possibly that this person may be related to them. Can you provide us with any sort of update on what's happening with the student?
I have not heard any information about the student. I have not anything personally to add to that.
Okay. And just for clarification, can you recount the latest stats for us for those who who would have missed it from this morning? The cases
stats
and
are
the
given.
numbers. Yes, please.
They should be on the website. I have not got the website in front of me. I'd probably click it to find out the information. So this is purely from memory, which wouldn't be a good idea
Okay,
for me to give
fair
from
enough.
memory.
Fair enough. Okay.
But okay, thank you.
Okay, thank you. One more, Dr. Lee, sorry.
One more.
Thank you, Dr. Lee. This morning, you had talked about an investigation was going to start looking into, I guess, the recent actions, I'm assuming, of the patient at Health Services Authority. We've fielded some questions, people asking if it's possible to, at this point, give any information about maybe where that person would have been, even within the Cayman Islands, or if that person who they might have come in contact with, et cetera, right? People are worried about their own safety and who they may have come in contact with. Is there any details you can share about that patient's recent history, possibly?
No, not. It's not normal practice that anybody would talk about the details of any individual contact tracing episode. So, but it's also the fact that when you're doing contact tracing, you look at immediate close contacts. You don't really look, for this condition, you don't really look too far beyond that sphere. So, for example, if you were to, if I had COVID-19 and minister came and asked me a question briefly at my desk and went off again, that would not be considered a contact. So it's not, it has to be a lot closer than that. We're looking at close household contacts or some other, if it's in the hospital setting, some other close and intimate thing being less than 1 meter for over 15 minutes. It's not a brief contact in society. So I'd feel reassured by that. Probably a lot of travellers have been in contact with somebody with COVID, passing them in a corridor, sitting in the same chair, that sort of thing. But that's not the sort of contact that we would trace, not for this condition.
And can you just describe your protocol if you do identify a place where that significant contact may have taken place? Would you reach out to the organization or the individual?
Yeah, it wouldn't be me, no. So one of the public health team would do that. I think Dr. Williams said this morning that the senior public health nurse was going to the household where this person lived and was going to do that job this morning.
So people don't just need to worry. They would be contacted by somebody
Yes.
if there were a reason
Yes.
to. Okay,
Yeah.
cool. Thank
It
you.
would be.
Dr. Lee, before you go, please, apologies again. I know we undertook yesterday when we were discussing the Cayman national, the Cayman resident who would have passed away in Honduras. Have you had any further feedback from health officials there on that particular case, Mr. Gary Castillo, I think it is?
No, I haven't had any official notification. Normally the notification for that would go to the United Kingdom because for this particular purpose, that is the reporting line, and then it would come to me. That reporting line is normally very quick, but I have not had any official notification now.
Okay, thank you.
Thank you. Sorry.
I just want to say some persons are still asking questions in regards to essential persons that are working up until 7 o'clock. And, when you get off at 7 o'clock, your shift doesn't just end. You need to do some other stuff, and then you probably get off 7:45 or whatever. And someone's picking you up. They're asking the question of the person that's picking them up is not an essential person because the person doesn't drive, but they're picking up someone that is doing essential work. So the police will have common sense, will have a common sense approach for these persons who are on the road for a particular purpose in picking up an essential worker. And I think Commissioner could probably confirm that.
I think the best way I can answer that is this is not a pass for persons to go and collect people from work. Agree with the Minister then, we will have to apply common sense and sound judgment, and each case will have to be considered on its own. But I think the primary message is if you do not need to be on the road during the hours of curfew, please do not go on the road. That's either walking or driving.
Yes.
Mr. Premier, I think this one is for you, although it might be for His Excellency. There are a couple of people who've sent in similar types of messages. I'll just pick this one in particular. Persons are stuck in Honduras and they want to find out how they can get home because the president, I guess, there says that countries can fly in and remove their citizens.
Well, we've been trying. I don't know if they're trying today. I don't know. I haven't had any report today, but we tried for quite a while to be able to get a flight into Honduras after they closed the airports, and we were not successful in persuading the government they should let us come. I will take this up again with the Deputy Premier and Minister of Tourism to see if the position may have changed in the last few days.
And from a fellow media member, are media personnel going to be considered essential?
Sorry?
Are media personnel going to be considered essential?
Yes, media are essential personnel. But that doesn't mean they need to be on the road during the curfew.
And a question that you kind of touched on. No, I don't remember if it was today or not. People are very specific. They do want to try to follow the rules. So, for example, this gentleman says, are the beaches closed because we live next to the beach and we have 4 people in our household? Can we go to the beach if we stay 6 feet away from everyone else? And lots of variations of the same.
Yes, that is currently the case.
Yes.
Yesterday, I warned about the behavior that and I have the actual photographs of it at beaches over the weekend. And we warned that if that didn't change, then there's a risk that the government would be forced to close the public beaches. But that's the last thing we really want to do. People need a place to get out and get away from it all, especially when you're just under so much stress, to run, to walk, to have a swim, but not to have a party with a dozen people.
I think that's clear. One more before Reshma. Someone has asked if we could just recap to make it clear what can be open during the day and what can be open during curfew. Because I realize we're not at shelter in place yet, so this
Right.
could change tomorrow.
Right. So at present, it's business as usual, subject to the numbers of people allowed within a space and the requirements of distancing. Tonight, everybody who is not on that list of emergency and essential services, supermarkets, restaurants who are doing delivery, utilities, are not to be on the road from 7 p.m. until 5 a.m. tomorrow morning.
Thank you. Governor, maybe you can answer this question. Are there any plans for prisoners who have court appearances to keep them in prison rather than have them being transported to court for court hearings? Do you have any word on if that is going to happen?
I think that's all been suspended anyway, so I'm not sure that that is going to happen. But we are looking actively at what measures can be taken to help ameliorate the concerns that exist in the prison by staff and prisoners alike. And obviously we'll try to do what is sensible in the current climate that we're in.
Thank you.
And a question I don't want to have to be the one to ask from Facebook, but I will do so. Why are liquor stores being listed as essential? And the person says, surely they're not on the same level as other true essential services. The concern here being that intoxicated people might be less likely to respect the boundaries of curfew.
Well, let me explain. We haven't declared the liquor stores as essential services yet. We might, but we haven't yet. The list that I read from are all essential services in the sense that they are security, personnel, prison service, the hospitals, the doctors, the supermarkets, and the utilities. They are not allowed to open during the curfew. Their personnel are allowed to carry out their work and their business, whether it's stocking shelves or arresting people who are breaching the curfew, or repairing a water break or an electricity outage. Those are the functions they can carry out during the curfew, not the usual daily business of selling goods and so forth. So it's clear what the curfew allows them to do. We're not opening the country back up so that people can go out and buy stuff, procure services. It's to allow these places to function so that Kirk's and Hurley's and Foster's, when you go there at 6 o'clock in the morning, they have stuff on the shelf that you can buy.
Several people have asked about reports. They're hearing that there may be some positive tests at law firms. Is there anyone who can speak to that, or is that something that's too confidential to address?
Well, it's one of the reports that caused great concern this morning, because we don't have any evidence whatsoever, and this just underlines again his point about fake news and reports that people put out without checking whether there is any fact to them at all. So I don't think anything more needs to be said on that.
Nothing has been reported to me as Minister of Health, and what I said earlier yesterday was, about prejudices against persons who may just have a cough or a regular flu, and automatically someone starts to point a finger. We want you all to be very respectful.
So if I can reiterate what the Chief Medical Officer, I'll try, said yesterday. The public health law imposes an obligation on anyone who is aware of an infectious disease to report that to the Chief Medical Officer. If any medical personnel conduct tests and conclude that someone has an infectious disease, they have an obligation under penalty of law to report that to the Chief Medical Officer. The Chief Medical Officer, who I spoke to just very recently, is not aware of any other cases except those that he has spoken about. So where this rumor comes from, there's not just one law firm, there's supposedly 2 law firms. I've seen the text messages of some of them. People swearing they know for certain that this person is positive. I've seen them too. But I haven't seen any evidence that that's the case. We really have enough challenges and enough stress to deal with without the fake news. For real, man. For real.
One person has asked, just to, if it's possible, to address this question. We have public streets and public roads, but we also have subdivisions and communities with private roads. And so they're asking, does the curfew mean I can't be in the private streets of the subdivision or of the strata compound?
I think the answer to that is yes, it means you've got to stay within the confines of your yard.
Or no, you can't go in the public street, private street.
Or no, you can't go on the street.
Right. Gentlemen, is there anything that you want to make sure that we get across? I know we are maybe belaboring some of the points, but people are tuning in and out and are just catching up with us now.
So I'm just picking up on your question and my response. The purpose for all of the things we are doing is we are trying to break the transmission of this virus. As we know, we're almost certain now it's in the community. To reduce the risk of people passing it one to another. So we want to keep people apart from each other. That's what we're trying to do. All of these measures, some of the more complex and most troublesome, that's what we're trying to do. Reduce congregation of people. It's very difficult because we are social animals. We want to be together. We want to have fun. But we've got to buckle down as a country and as a people for the next 10 days in particular and just do this. And God, we pray it works, because life will get a lot better and a lot easier after that.
Well, on that note, I think it's about time to wrap things up. I would suggest that if you haven't already, please visit gov.ky/coronavirus. There is a great deal of information on there, a lot of different topics and subjects. Some of the same questions you're asking now will be answered on there if they're not already. And again, thank you very much for joining us. Please feel free to continue to send your questions and comments into us via Facebook, YouTube if you can. You can email many of us. We're in the media as well. But again, be safe out there and do follow the instructions as provided. Thank you. Thank you, gentlemen.